Hello everyone, welcome to the session. Welcome to the M3 Academy MCQ meets mnemonics. Yes, and today we are discussing about the 28th notebook. Yes, obviously 28.5 notebook. The secret of the point 5 we will see in this session. Yes, please comment about the audio visual so we can start the session. Yes. So we are discussing the common mistake should be avoiding during the preparation of the 20th notebook, how we prepare, how we revise in this session. Yes, obviously we also share the smart strategy to consolidate your materials. Yes, please join the session and also give a quick notes about the audio visual. Yes, if you have any doubt, you can ask in the comment box. I will answer your doubts in between. Yes. Sir, your doubts. Yes. Audible? Yes. Audible? I think now audible. Yes. Audible? I think. Yes. So yes. So we are talking about the our syllabus. Our most of the syllabus is based on the factual memory. Yes, fact type the data. Yes, so this need to be memorized. Needs to be revised very frequently. This need to be revised very frequently. So if you collect your forgettable, your volatile, your factual data in a separate notebook, you will easy to revise in your last days, last month, and obviously you can reproduce in your examination. Yes, the concept based things we already know from the MBBS. Yes, इफ आई यदि मैं अभी काफी टाइम पहले मैंने कोई टॉपिक नहीं पढ़ा हो और मुझे कंसेप्ट उसके पता है तो मैं उस क्वेश्चन को सोल्व कर पाऊंगा, बट यदि मैंने उस क्वेश्चन के जो फैक्चुअल डाटाज है वो फैक्चुअल जितनी भी चीजें हैं वो रिवाइज नहीं करी तो उनके आंसर में यहाँ पे नहीं कर सकता. यस, so this is the important. So our half of the syllabus is based on the concepts. Yes, and the rest of this fact based syllabus need the revision, frequent revision. Obviously last minute look is very important. Yes, so now, so what is the indirect advantage of this 20th notebook? Yes, what is the indirect advantage of this 20th notebook? Yes, so in the last month of examination, obviously, yes, now audio is connected. Yes, yes. So in the last month of the examination, our anxieties is increases, our stress level is increases, and we often have this tendency that we will not able to revise to vast syllabus, and notes is too vast. Yes, so एग्जाम के लास्ट महीने में ऐसा लगता है कि सिलेबस का भी बढ़ता जा रहा है, हमसे रिवाइज नहीं हो पा रहा है, इतना ज़्यादा पढ़ रहे हैं, आगे आगे पढ़ते जा रहे हैं, पीछे पीछे का भूलते जा रहे हैं। तो वो सारी दिक्कतें आने लगती है। तो इन सबको कैसे ओवरकम किया जाए, यस, यदि आप एक अच्छी तरीके से 28 नोटबुक बना के रखेंगे, इफ़ यू आर made up with a good 28 notebook, you will revise your forgettable. Obviously your forgettable are filtered, and this revision of your forgettable give the completion of your syllabus, and this give you confidence. This confidence reducing your anxiety. Obviously if your stress and anxiety level is reduced, your performance is examination is increased. Yes, so why we say this 28.5 notebook, not the 28 notebook, because we already given you the most of the forgettables, most of the volatile material in your topic group. Yes, so most of the session we are conducting that based on your forgettable volatile, yes, derived from the your mnemonic request test. So this already we are simplifying many difficult topics, so your time, your efforts is already saved. You just add these topics in your 28 notebook. Yes, so now what is the 28 notebook? So we already say this is personalized revision tools. Yes, because everybody has a different difficult topic, everybody has a different area of the forgettables. So this is the personalized revision tool. Yes, you cannot use the 28 notebook of the any other and you will correct the examination. This is a big myth. Yes, obviously you should make your 28 notebook yourself based on your forgettable, based on your wrong questions. Yes, so you are putting the all the volatile forgettable which you find difficult in this book in the very concise manner. Yes, we will see how we concise this book now. So this book about the other things which you want to revise in the last minute, but obviously you should start revising this book from the day of the making. Yes, so this notebook may be physical, maybe the digital notebook, but the advantage of the physical notebook or hard copy is very easy to develop your image-based memory. Yes, digital notebook is not helpful for the developing of the strong visual memory. Yes, if you have the physical notebook or you have the hard copy, you easily take this is very handy and you easily develop your image based memory. Yes, obviously you are capturing the photograph and making the PDF of that notebook, so you will revise in this way also. Yes, so right time when we should start making this 28 notebook. So we should start this making of 28 notebook after our first read or after the solving our first round of the cubing. Yes, yes. So this is the best time, and obviously the NEET PG exam is near, INI-CT is near, and this is a perfect time to make the 28 notebook if you are not started yes yet. Yes, so this is the right time. If you start making 28 notebook from the first day of your preparation, obviously on the first day of your preparation, your syllabus is too vast. Yes, everything you need to learn, everything you need to memorize, everything you need to practice. So you will add each and everything in 28 notebook. So 28 notebook is become more than your 19 subjects. So this is advisable that you should make the 28 notebook after at least your first reading, at least your first round of the solving the cubing, so you know which area is your forgettable, where you are lacking in your recall. Yes, so you will add this point. So how you make? Yes, so you can take a notebook and you can divide these pages in the 19 subject. Yes, you can give the less pages for the short subject, more pages to the long subject. Yes, you can give like to 5 to 7 pages for the short subject like the dermatology, and you will give 15 to 20 pages for the medicine or OBG. Yes, so you can take the a notebook and divide subject wise. Yes, obviously you are giving the more pages to the long subject, and how we divide further in the subject. Like you taken the anatomy, yes, anatomy, and you are taking the 10 pages for the anatomy. So you can divide the set of the three pages, and initial 3 pages is kept for the wrong question from the your PYQs, your GTs, and your subject wise test. Next 3 pages related to the your volatile or last minute revision stuff, and last 3 pages related to any new topic which is not in your notes, you will not read it in your notes, which is recent updates. Yes, you will kept adding in the last 3 pages. So in this way you can divide your subjects pages in the 3 folders. Initial one is a wrong questions, later one is a volatile or LMR stuff which you need to revise in the last minutes, and later one is the new topics or the recent updates. Yes. So where to begin? From to begin the making the 28 notebook. So while you are solving the PYQ, your GTs or subject-wise test, if you found anything forgettable, volatile, if you keep making that topic mistakes, you can add in this notebook. Yes, so what should be the contents? Yes, so content should be volatile as well as important. If content is forgettable, content is difficult but is not important, not previously asked, please do not add in your 28 notebook, because it create unnecessary burden on your memory and it give unnecessary anxiety and stress to you. So please keep adding those point which is volatile as well as important as well as previously asked topic. If you are adding, so most of the many topic you found that are important, yes, and volatile. So please add those topic only. Yes, if you found this topic which are forgettable, which are difficult but not asked in any exam previously, please do not add such type of the topic. This topic create only unnecessary anxiety, unnecessary burden on your mind. Yes, so which type of the content we should add? So here is a list of the some examples. Like you can the emergency contraception is very important. Each and every year there is a question on the emergency contraception, but the examiner are also asking the dose. Yes, what is the dose of the ulipristal? So this type of the doses based question you can add. Yes, obviously the unit is also important. Remembering dose is not important, but the unit is also important. Examiner can switch the doses 30 mg, 30 microgram. You can make the wrong question. Yes, so important keyword which are highlighted by the black line, you can edit. All the tables you will add in your 28 notebook, but only add the less material of the table. If you a table comparing between the two things and which thing have less points, so you should add the only less points. So other you can easily tell about the टॉपिक। यस, तो यदि किसी टेबल में दो चीजें दी हुई है तो जिसमें कम पॉइंट है वो अपन ऐड करेंगे। यदि आपको दिया हुआ है कि यदि आपको दिया हुआ है दो तरह की चीजें दी हुई है तो जिसमें कम पॉइंट है वो अपन ऐड करेंगे, दूसरा अपन आसानी से बता सकते हैं। यस, ऑल द फ्लो चार्ट, ऑल द मैनेजमेंट गाइडलाइन वी शुड ऐड सिमिलर नेम टर्म, लाइक वी कैन से द paper and salt and pepper appearance in the various subjects, so you can add this type of the terms. Most common and least common, most specific, this is very important, so you have to add all the investigation of choice, drug of choice, treatment of choice, all the name things like named surgeries you have to add. Yes, all the named classification, diagnostic criteria, named antibodies, formulas. Yes, formulas you have in the different subject, like formula of the PSM, formula of the medicine. Yes, calculation of the sodium, the formula of the pharmacology. Yes, obviously suture material table, tumor markers, health programs, updates. Yes, bacteriology reaction which is UDS positive. In this type of the things you have to add. Yes, staging of the cancer scores and your incorrect PYQ point. If you incorrect any PYQ, yes, you must add in your 28 notebook, because you incorrect one time, you will do in wrong in next time also. This is your tendency, so please add this point also. And all the mnemonics, because mnemonics also need revision. Yes, mnemonics is helpful for memory, but mnemonics also need revision, so please also add the mnemonics. And we already simplified many of the topic for you, for your effortless recall, for your time saving. Most of the difficult topic, most of the difficult gems pearl we already simplified, so you can easily add the mnemonics, recent update, and try this type of the things you have to add in your 28 notebook. So what is the smart way to प्रिपेयर द 28 नोटबुक। तो अभी तक आपने देखा 28 बुक में किस किस तरह की चीजें नोट करनी है, वही चीजें नोट करनी है जो फॉरगेटेबल है, वोलेटाइल है, डिफिकल्ट है, प्लस इम्पोर्टेंट है। यदि चीजें डिफिकल्ट है, इम्पोर्टेंट नहीं है, प्रीवियसली आस्क नहीं है, आपको ऐड नहीं करनी है। यस, सो व्हाट इज अ स्मार्ट वे टू Yes, what is a smart way to prepare the 28th notebook? Yes, so do not type the heart, do not type the lungs, do not type the kidney. Please make the symbols of the heart. Yes, if you want to write the heart, you have to make this symbol. If you want to make the lungs, you have to write this symbol. If you want to tell about the kidney, you have to make these symbols. Obviously, these things create the attractive notes. Also, your participation is increases. Yes, notes become attractive by this type of these stuffs, and obviously this save time. This is eye-catchy material. So yes, so you have to convert your theory, your keyword in the symbols. Yes, and you can use this more than, this less than, this arrow, this higher, and this type of the lower type of the keyword. Yes. Now, so next things, focus on the variable keyword like hypo, hyper, less than, more than, right, left. Yes, any keyword which has the opposite contrasting word you have to add. Yes, like the examiner just switching the keyword like hypogammaglobulinemia. Examiner just change this thing with a hypergammaglobulinemia. Yes, screening test, examiner just change the diagnostic test. Yes, absolute indication, examination ask is the relative contraindication. Yes, so this type of the things, relative, absolute, hyper, hypo, more than, less than, and all the numbers. Yes, we discussed about the Marfan syndrome, fibrillin 1, but is option like fibrillin 1, 2, 3, 4. Yes, so examiner just change a 1, 2, 3, 4. Yes, so your remembering of the fibrillin is going to be wasted because you will not remember the number. So here is the importance of the 28th notebook. You have to remember the numbers also. Yes, so just add this type of the things, focus on this type of the things which is accept, paradoxic, numbers, units. Yes, numbers, units, because this is easily examiner can change easily. Yes, सो ऐसी चीजों को एग्जामिनर आसानी से बदल सकता है, जो भी वेरिएबल है उसमें थोड़ा सा वेरिएशन करेंगे और उसमें आंसर यहाँ पे बदल जाएंगे. यस. So now next, so use the different color pen, highlighter or sticky note to segregate the material. Yes, you can use the arrows, you can use the box. Yes, you can use the box to segregate a different material. If you are mentioning about the four drugs, you can make the different boxes. Yes, and if you are trying to making a table or comparative study, you have to put the shortest material. Yes, now if you want to present the human different type of the symptoms of the different organs, you have to made make a ह्यूमन बॉडी डायग्राम. यदि आप कोई ऐसी चीज बताना चाह रहे हैं जो अलग अलग सिस्टम से रिलेटेड है, तो केवल एक ह्यूमन बॉडी का डायग्राम बनाएंगे और उस पर आप लिख देंगे the symptoms related to brain, this dizziness, this tachycardia, this oliguria you can make. So this human body schematic diagram is easily presentable, easily revisable. Now, so you know this is choti copy. Yes, 28 notebook is choti copy. So please do not make is a bigger copy than your 19 subject. Make the notes concise. Only use the symbols. Only use the keyword. Only use the variable. Yes. So you can take the photos for saving your time, and only two step, make it and revise it. Yes. Only add the stuff when you ready to revise at least 5 times. If you ready to revise at least 5 times, यदि आप किसी भी चीज को 5 बार पढ़ने के लिए रेडी हैं, 5 बार रिवाइज करने के लिए रेडी हैं, तभी उसमें ऐड करें. अदरवाइज अननेसेसरी आपको इसमें स्टफ नहीं बढ़ाना है. यस. नाउ, सो नेक्स्ट इज yes, this 28th notebook is for the last minute material. Yes, your last month, last date material, but you have to revise this from the today only. Yes, every day you have to revise to develop your image memory. Otherwise, in last time you will feel this topic new. Yes, uh, yes. So the perfect way is revise every day to develop the image memory. At least 30 to 60 minutes every day you have to invest to revising this 28 notebook. Yes, which thing we do not add in the don't add in the 28 notebooks. Yes, things which are not volatile, things which are conceptual, things which are volatile but not important, things which are not asked previously in any of the standard examination, and things which can rule out. Yes, so this type of the things you cannot note. Yes, now this is example how you concise your material, how you consolidate your material. Can anybody identify this? Yes, this content is related to the which topic? Yes, can anybody identify this content is related to the which topic? Yes, we already made the session on this topic. Yes, many of you attended also. Yes, so this is the von Willebrand criteria. Yes, von Willebrand disease type. Yes, so this is about the von Willebrand disease type. So you can say the von Willebrand disease is a three type: first, second, and the third. First is the most common. Yes, first is the most common, and you can say first and second show the missense mutation. First and second is the autosomal dominant. Third is autosomal recessive. And second is a qualitative defect, and first and third is a quantitative defect. Yes, and third is by the deletion. Third is most severe. Third is most severe. Yes. So this small diagram represent the more than the 30 points itself. Yes, which is most common, which is widely deletion, which is missense, which is autosomal dominant, which is autosomal recessive, which is qualitative defect, which is quantitative defect. Yes, इतनी सारी चीजें आपने एक ही बॉक्स में आप रख सकते हैं. इसको कैसे मैंने यहाँ पे बनाया? यस, जस्ट यहाँ पे लिखा 1 2 and 3. ये दोनों ऑटोसोमल डोमिनेंट है. दिस इज ऑटोसोमल रेसेसिव, दिस इज क्वालिटेटिव, दिस इज क्वांटिटेटिव, दिस इज मोस्ट कॉमन, दिस इज डिलीशन. यस, so in this way, this small representation can represent the total von Willebrand disease type. Yes, if you convert this theory, it become more than 15 to 20 lines. Yes, so in this way you have to concise. Now you have to use the smaller word. Yes, to summary word to the short term. Like the mental retardation, you have to write the MR. Yes, like corneal clouding, you have to write the CC. Yes, Course faces CM visceromegally VM. So this is concise version of the mucopolysaccharidosis. In this way, I write this and just write a small keyword which is not present. Also, I relate with the pharmacology part. What is the treatment of the choice? In this way, you can represent, you can consolidate your 28 notebook. Yes. So here are so many samples I put in this diagram also. Yes. So this picture represents the total brachial plexus. This small boxes. Yes, this small boxes is every PYT previous year topic of the brachial plexus. You can also made. Yes, this is a antiretroviral drugs. Yes, this is a classification and this is the individual drug point. This one page I made for this antiretroviral drug, and I made a separate notebook for the score at that time, but you can include that type of the score in your subject wise session. Yes, so if you have any doubt you can ask in the chat box. यस, सो इस सेशन में अपन ने देखा 28 नोटबुक कैसे बनानी है. हर सब्जेक्ट के अलग अलग पेज उसमें देने हैं, और जो सब्जेक्ट के पेजेस है उनको 3 पार्ट में डिवाइड करना है. शुरू वाले में जो भी क्वेश्चन आप गलत करेंगे सब्जेक्ट वाइज टेस्ट प्रीवियस ईयर क्वेश्चन में वो ऐड करेंगे. उसके बाद के जो पेजेस रहेंगे उसमें आप आपके वोलेटाइल ऐड करेंगे. उसके बाद के पेजेस में कोई भी आपको नया टॉपिक मिलता है जो आपने नोट्स में नहीं पढ़ा, कहीं नहीं पढ़ा और रिसेंट अपडेट है, वो उसमें ऐड करेंगे. यस, सो काफी छोटा छोटा लिखना है, केवल कीवर्ड लिखने हैं. उसको भी सिंबल्स के साथ में लिखना है ताकि आप उसको रिवाइज कर पाओ, और जो भी चीजें हैं उसको अभी से रिवाइज करना शुरू करना है. ऐसा नहीं है 28 नोटबुक बना ली, एग्जाम के लास्ट डे रिवाइज करेंगे तो आपको एकदम नई नई मिलेगी. यस, इसमें विजुअल मेमोरी भी काफी इंपॉर्टेंट है. आपको रोज का इसमें टाइम असाइन करना है, रोज का टाइम देना है कि 30 मिनट 1 घंटा आपको 28 नोटबुक के रिवीजन में लगाना है. और किस तरह से मटेरियल को कंसाइज करना है वो अपन ने इस सेशन में यहाँ पे देखा है. और जितने भी आपके फॉरगेटेबल फॉरगेटेबल वोलेटाइल है जो आप निमोनिक रिक्वेस्ट सेंटर में पूछते रहते हैं, वो ऑलरेडी हमने बनाए हुए हैं। सो मोस्ट ऑफ के जो वोलेटाइल होते हैं वो सेम होते हैं, कुछ कुछ डिफरेंट होते हैं। सो उनके फॉरगेटेबल के निमोनिक ऑलरेडी अवेलेबल है जो कि सब्जेक्ट वाइज सेशन में डिवाइडेड है। यस, so thanks for the participation. If you have any doubt, you can ask in the chat box or on the Telegram.